Hi, I'm Larry Kestin, a radiation oncologist in Michigan. I am the medical director of the Michigan region for Genesis Care, uh, MHP Radiation Oncology Institute here in the Detroit metropolitan area. Is adjuvant radiation therapy indicated for resected non-small cell lung cancer? Well, post-operative radiation treatment for non-small cell lung cancer has been a controversial topic for many years. Um, I think a still clear indication is gross residual disease or microscopically positive margins after surgery. In that setting, where there is residual disease, radiation treatment postoperatively is reasonable. As long as one can target or identify the residual disease or positive margin location. But obviously, this is a relatively small subset of surgical lung cancer patients. Historically, adjuvant radiation treatment has been most commonly offered for patients with pathologic stage N2 disease. Typically with negative margins and no gross residual. So just the fact that there were, positive mediastinal lymph nodes, positive N2 disease. Many randomized trials have been conducted over the last few decades using older postoperative radiation therapy techniques that have shown various improvements in local control or regional control, fairly consistently, but not so consistently demonstrating disease-free survival advantage, and definitely very inconsistently, rarely showing an overall survival advantage, and in some cases, even a detriment in overall survival with the addition of postoperative radiation treatment. Recently, the LungArt randomized trial, which was conducted in France, was presented at the European Society for Medical Oncology earlier in 2020. And this trial randomized over 500 stage N2 non-small cell lung cancer patients to receive modern conformal postoperative radiation treatment versus no postoperative radiation treatment following surgery. And 95% of those patients also received chemotherapy, typically postoperatively. So this was a large, more modern trial looking at the value of postoperative radiation treatment. And the trial demonstrated a reduction in mediastinal recurrence rates with postoperative radiation treatment, but only a very slight, non-significant improvement in disease-free survival, and even a slight detriment in overall survival, which was not statistically significant, with the addition of postoperative radiation treatment. The study also showed a higher rate of late grade 3 to 4 cardiopulmonary complications in the postoperative radiation therapy arm. And so based on this latest trial, many experts agree that postoperative radiation treatment is not indicated for pathologic stage N2 non-small cell lung cancer, which again would have been the primary reason that many would have recommended it in the past. I still would recommend postoperative radiation treatment in the setting of positive margins or gross residual disease. So I would only recommend postoperative radiation treatment in the setting of positive margins or gross residual disease, as these were patients that were excluded from the LungArt trial.